I think that tackling loneliness should be a key priority for all local authorities. I think nationally we're facing a big challenge. People are living longer with longer term conditions, and at the same time we are facing decreasing spend. I think key to that as well is the provision of good information and advice so that people are aware of the full range of services and support that are available locally, including those that are experiencing loneliness. And I think by ensuring that older people have this information, the need for higher level and more costly interventions at a later stage will be reduced. OpenAge really supports people aged 50 and over to access an extensive range of activities to maintain their physical and mental well-being. Whenever we commission a new service, we always undertake a review to look at the service model to make sure that it's fit for purpose. The outreach model that operates in communities and facilities that people access already is the sort of preferred model that we want. I think for the individuals that are accessing the service, it will improve their quality of life, their health, that's physical and mental health, that they'll be able to contribute to their community, and I think really they'll be able to remain independent. From a local authority perspective, it'll reduce or delay the need for residential care or nursing care. I think that it'll reduce or delay hospital admissions and delay discharges.
OpenAge began about 21 years ago. Today we're now offering around 400 weekly activities to older people in 3 boroughs in central London, working with about 1,200 or 300 individuals each week. Our funding is very complicated. We're very fortunate that our 3 local authorities, Kensington, Chelsea, Westminster and Hammersmith and Fulham, each individually provide some funding towards our work. We also get funding through public health and also some funding through health clinical commissioning groups, plus the big lottery and other trusts, smaller trusts and foundations.
I think it's important that commissioners work to identify those people who are classed as lonely and actually realise, what are the causes of that loneliness for that individual. A one-size-fits-all approach won't work. I think that local authorities and commissioners need to undertake research, look what's out there, look at the evidence base, what approaches are working elsewhere, and actually adapt to those to develop a wide range of one-to-one and group-based services and activities.
I run and manage the Link Up project, which is working specifically with people who are isolated or at risk of isolation. And I visit people at home and work with them on a one-to-one basis to help them address any barriers they have to accessing activities and getting involved in their community. Referrals to the Link Up project come from a variety of different sources, primarily from adult and social care and health professionals. We recently conducted our annual evaluation where we asked our members to feedback to us how they found coming to OpenAge activities, and 82% of people who responded said that agreed or strongly agreed that they'd made new friends since joining OpenAge. We've also got some good feedback from people in terms of quotes. For example, someone said, "I always feel valued, loved and the very opposite of lonely." Another person said, "It gets me out of the house and meeting like-minded people. It makes me feel less depressed and isolated."
OpenAge was a beginning for me to continue the things that I like best, which is singing, dancing, drama, and also painting. I love painting.
There's nothing worse than loneliness. I've experienced it, and I lost my husband at a young age. I lost my son. I came along one Tuesday and I've been here for 2 or 3 years, every Tuesday. It's maintained my mental health. It's given me more stability. I've made some very nice friends and I've met some very nice people.
There's no prejudice at all in OpenAge. It's nice to have an organisation who brings people together.
Doctors, nurses, pills all help, but you can't beat a bit of exercise and friendship.